Hi, I'm Barry Ostrowski. At RWJ.Barnabas Health, we believe that everyone needs to be informed about the important healthcare issues affecting their lives. That's why we're proud to support the important educational programming produced by the Caucus Educational Corporation.
State of Affairs with Steve Adubato is brought to you from the Agnes Varus NJTV studio at 2 Gateway. Funding has been provided by RWJ.Barnabas Health, Delta Dental of New Jersey. Everyone deserves a healthy smile. The Turrell Fund, supporting Right from the Start NJ. The Nicholson Foundation, supporting Right from the Start NJ. The Robert Wood Johnson Foundation. NJ Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. And by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation.
Hi, I'm Steve Adubato. This is State of Affairs. We, in fact, are coming to you from the Agnes Varus NJTV studio in Newark, New Jersey. It's my pleasure to introduce Dr. Shereef Elnahal, who is the Commissioner of the New Jersey Department of Health. Commissioner, good to see you.
Thanks so much, Steve.
Tell folks a little bit about your background before you came into this post.
Sure. I actually grew up in New Jersey in Atlantic County. I grew up between Galloway Township and Linwood. Went to high school at Mainland Regional. And I've spent most of my career actually outside New Jersey before being afforded the opportunity to come back here and serve. Ended up going to medical school up in Boston, also got an MBA up there, and decided to really focus on not just healthcare provision as a physician, but the systems of care that support folks on the front lines. And so got into operations management, quality, safety, ultimately policy, served in the Obama administration at the Department of Veterans Affairs, where the governor became aware of the work that we were doing, and I was really glad to come back and do this, this role. Yeah.
By the way, I was talking with the commissioner before we got on. This, in fact, is the unofficial start, if you will, of a series of programs simply focusing on the future of healthcare in New Jersey, also in the nation, but our mandate, if you will, is New Jersey. This is, in fact, the future of healthcare. And let me ask you, to that end, Commissioner, how confident are you about the future of healthcare in this state? A, and B, what are the biggest challenges we face?
I'm really confident about it, Steve. And the reason I say that is everybody I've met, from hospital executives to folks in the front lines like community health workers who are in our inner cities, finally reaching communities that we failed to reach thus far for some of our public health issues, all the way to business leaders and folks that you normally wouldn't think have a hand in healthcare, but ultimately do by improving the economy and improving people's well-being. All of them are ready to start building an innovation economy here in New Jersey.
What does that mean?
That means starting to bring in new ideas, new entrepreneurs, people who are actually creating new solutions for some of our toughest healthcare problems. And part of what we're focused on in the Department of Health is not just, of course, improving public health outcomes, but also bringing innovation to the table and to have New Jersey essentially become the Silicon Valley for healthcare and new technology, new solutions for these issues.
It's interesting. One of the issues that we were talking about before we got on the air involves technology as well. There's a report that was put out that really talks about the end of life issues. 25% of all New Jerseyans die in hospitals. And actually, the Nicholson Foundation funded a study that the Healthcare Quality Institute put together. Why is it relevant that so many people die in hospitals and so much money is spent on quote-unquote end-of-life care disproportionately in New Jersey? Why is that an important issue?
Steve, I spoke at that event recently commemorating this report and how important it is. It's a really important issue. The fact is, people are not getting treated the way they should near the end of life. And the first step is, of course, asking people well before they are in the emergency room or on their deathbed how they envision the final days of their life. Do they envision it at home? Are you treating their pain? Are you treating their symptoms early on? There are studies that show, Steve, that when you do that properly, not only does your quality of life improve as a patient, your well-being improves, your family members' well-being, and even your lifespan is extended if you're offered end-of-life care the right way earlier on in your disease process.
But there has to be an honest discussion about this.
It really has
And we're
to
not where we need to be.
We're not. We do not record people's preferences for care, their goals of care. We provide the most aggressive care out of any state in the country.
Aggressive meaning expensive.
Expensive is part of it, but also we're doing procedures. We're keeping people alive, oftentimes not knowing what their preference would have been otherwise. And this is all about matching what people want out of their life into their care. And we're not doing that right.
Can I get a quick one on this? We're collaborating with the New Jersey Sharing Network, organ and tissue donation. By the way, look at our website or connect to theirs to find out more about organ and tissue donation. What is the role of the Department of Health in the whole question of organ and tissue donation? Because there are at least 4,000 to 5,000 New Jerseyans waiting right now for an organ.
Yeah. So we, of course, maintain the registries and have a role in organ donation. A lot of that is carried out, of course, by the hospitals and the hospital system. We communicate regularly with them to understand what the supply and demand is for organs, and we have a role to play in that. It's an important one as well because we want to make sure that we're supporting the folks in the front lines doing transplants and connected well to the trauma system. We have an advisory committee on trauma that addresses some of these issues as well.
You know, I was watching, as most people do, NJTV News. We're actually taping right here in the studio at NJTV in Newark, and you were talking about, I'm not sure if it was a conference or what it was, but there was a comprehensive report on the opioid crisis in this state. You and your colleagues at the department are very involved. Talk about it.
Yeah. We are on track, Steve, to have over 3,000 deaths from opioid overdoses this year.
3,000.
3,000. That number is much too high. It's not getting better. In the last administration, there were a lot of good laws passed that's starting to get us there, but we haven't had yet a comprehensive public health approach. What does that mean? That means tracking the journey of someone from their initial exposure to opioids through addiction, through incarceration, overdose, and death, trying to make sure that people are not passing through each of those gates through effective interventions. Part of that battle, the governor has been out front saying this as well, is extending medicinal marijuana to folks with chronic pain.
You believe that's the right thing?
I do. There's a lot of evidence to say that it's an effective treatment for pain of many types, both from joints and bones and muscles, all the way to organ pain. Study after study has shown that it's effective. We want to make sure we're getting it to as many people as possible who we think can benefit. And we want that decision to be made by physicians on the front line who are seeing these patients.
Steve Adubato here. We're in fact speaking to the Commissioner of the Department of Health, Dr. Shereef Elnahal. Question about an interesting and complicated question about infant and toddler care. What is the role of the Department of Health? We actually have, Jackie, help me on this, Jackie, our producer. We have the head of the Department of Families and Children coming in, and we're doing an initiative dealing with questions revolving the health issues impacting infants and toddlers. Does the state have a role, the Department of Health have a role in that?
Absolutely.
Because I know it's broken down to a lot of the state agencies.
It is, but we work very closely with the Department of Children and Families on a lot of projects. One of the programs we have is called the Women, Infants, and Children Program.
That's
trying to
WIC?
WIC, yes.
Right. Our initiative is right from the start, NJ. You'll see up on the screen. Go ahead.
Yeah, and the entire idea behind that program is to provide support, services, access to healthy food for vulnerable communities, folks that are not being reached through food deserts and different things that allow them to access healthy food, but also things like breastfeeding training, making sure we're supporting mothers, new mothers in communities in the inner city that we're not able to get to with the traditional structure of the healthcare system.
Commissioner, why is, again, Commissioner Elnahal is in the House, Steve Adubato here. The question is also about infant mortality and why the rate is so much higher for African-American babies.
It's really terrible, Steve. We have among the lowest infant mortality rates in the country, but you can't celebrate that knowing that at best the black infant mortality rate is double across the state. In some places quadruple. It's because we simply have not reached the communities that we need to reach with our outreach efforts. We don't have the infrastructure there for people to receive prenatal care. The social stressors on black women in New Jersey, we found
toxic stress, as one of the doctors actually we talked to called it. It is toxic.
Absolutely.
What
it
does
is.
that mean?
That means that they are not able to tend to themselves and by definition to their child if they have so many different social stressors. There's employment issues. Many of these women are being forced to go back to work in a matter of days after they give birth. So we're talking about levels of stress that most women in New Jersey are not experiencing. And so we need to get to the root cause of these issues. It's one of the first things I asked my public health team to do, and we're already on track to do a lot for that problem.
By the way, before we have another couple questions for the commissioner, log on to our website. There's an article by Dr. Arturo Brito, who wrote about this whole question of toxic stress, which I never had heard before he said it. But real quick on this, the future of the Affordable Care Act in New Jersey and the nation is?
That is an open question, Steve. I'll tell
Complicated
you what
question?
we're trying to do in New Jersey. We're trying to stave off the continued attacks on the gains we've made with the Affordable Care Act that are coming from the Trump administration. We passed historic legislation establishing the first individual mandate since Massachusetts did it well before the Affordable Care Act. That'll hopefully stabilize the exchanges. We're also going to have a reinsurance plan that essentially covers the cost of some of the sickest patients in the exchange. That should help lower premiums and, of course, therefore have more people enrolling. And, of course, we're going to promote the Affordable Care Act open enrollment period way more than we have been before.
Even though the federal government has cut back on the amount of money you can use to, quote unquote, promote and educate. Am I wrong about that?
No, they've cut back on the money. They've cut back on the open enrollment period. So it used to be 3 months. Now it's only 6 weeks. So these are all intentional actions that are being taken in Washington to undermine the Affordable Care Act. And the people paying for it, Steve, are the patients, the people who've benefited from coverage, the people who've gotten treatment for diseases they've had for a long time but were denied based on their pre-existing conditions.
You're listening to Dr. Shereef Elnahal, Commissioner of the Department of Health in the state of New Jersey. I want to thank you for joining us here on State of Affairs. Hopefully you'll continue to be a part of our conversation on the future of healthcare in New Jersey and the nation. We appreciate you joining us.
Thanks so much.
Thank you, Commissioner. All the best.
Thank you.
Okay. We'll be right back right after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
State of Affairs is pleased to welcome Kevin Lyons, Associate Professor for the Department of Supply Chain Management at Rutgers Business School. Good to see you, Kevin.
Nice to see you as well, Steve.
First of all, describe supply chain management.
Supply chain management came out of an academic exercise of taking procurement, operations, research, and then formalizing it so that when you are in a major corporation, let's say, and you need to acquire goods and services, that you do it in a formalized way, and that all your agents and customers along the way are in that chain. So it's actually literal what it says. We want supply, but push it through a chain.
Let's bring it into Newark. There's an initiative that we've done some programming on. We've talked to Ras Baraka, the mayor of Newark, excuse my voice, and others, particularly folks at R.W.J. Barnabas Health, who have talked about this and as a part of their social impact initiative. It's called Hire.Buy.Live Newark, right?
That's correct.
Your team at Rutgers is part of the
Buy local.
Buy Local.
Correct.
What does that mean, buy local? When we're in Newark right now, we want everyone to buy local to support the economy, but what is Rutgers doing?
So when we look at buy local, we're looking at the large institutions. So that's Rutgers, NJIT, Prudential, NJPAC, Audible, and what are their buying patterns? So are we actually targeting our purchasing into the local economy so we can actually grow the local economy? So instead of business as usual, where we can get goods and services anywhere in the world, could we refocus that procurement activity to our local economy, our local small business, women-owned, minority-owned businesses, and then lift them as part of the economic development?
You know, as I'm thinking about this, you are talking about PSE&G, NJPAC, Prudential Financial, Prudential Center, Rutgers, NJIT, et cetera, as part of this initiative. How challenging is it to get folks who historically have been hiring people in a certain way,
Right.
certain culture? Talent pool is huge, and you say, you know what, there's a lot of talent here in Newark.
Yes.
And we're asking you to try to find that talent, recruit that talent, train that talent hard.
Yeah, what it really boils down to is that keep your same processes. HR is always going to be HR. But can we expand that reach to include our Newark residents.
Why should that be a thing?
It shouldn't be a thing.
I was sitting there going, you're in Newark, it's a big labor pool. Is there something, devil's advocate, is there a perception that there's something wrong with the labor pool?
No, not at all. And I think because we're in a globalized economy, you can get talent, you can get goods, you can get anything you need to make your organization great from anywhere. But what we're saying is that that talent also exists right outside your back door. So why don't we try to refocus that energy, develop those pathways in our schools to start to prepare the type of talent that you're looking for.
What does that mean, prepare them, pathways to school?
That means that when we start to think about these really important careers that we have in these large institutions, why aren't we not preparing our kids, literally as far back as grade school, to start thinking about, hey, we want technology, then guess what? We're going to invest the time and the effort to make sure that we are making our schools graduate the type of talent that we need. So this way we don't have to go searching globally. We can
Are the schools ready for that, or does Rutgers play a role in that training of younger people?
Yeah, Rutgers is, the schools are ready. And Rutgers needs to forge partnerships not only with the schools, but our county colleges need to be involved in this. Our trade schools need to be involved in this. We also have, kids that are not destined to go to college. So how do we prepare them enough so that when they do graduate from high school, that there is an opportunity for them here in Newark as well? So we have to look at the entire spectrum.
For someone outside of Newark, people watching us all over, you can imagine them saying, well, what about us?
Right.
You say?
Well, you're part of it. You need to be engaged. We need to be engaged with you. So this is going to be more of a proactive approach. We have to reach out. So instead of in the past where we just sit back and wait for talent to come to us, we have to put our HR folks on steroids to get them out there to do the job fairs, to get folks like myself. I'm not a HR person, but I should be advertising the fact that
as opposed to passive, hey, let's see who applies.
Exactly.
That doesn't work.
It doesn't work because, not everybody's, on the web. Not everybody's doing the technology as we think they probably are. But we need to go back to the old days of actually going out into the streets and actually pulling folks in.
Yeah, but you got me thinking about this in the time we have left, Kevin. For years, growing up in Newark and doing a lot of our business in and around Newark, you'd hear people say, there are not enough jobs. If there were only more jobs, there would be fewer kids on the street and young adults involved in activities they shouldn't be involved in, drugs, alcohol, crime, et cetera. But are the jobs you're talking about jobs that a lot of the folks we're talking about are trained for A, and B, what can we do to pull those folks in and give them an opportunity?
Yeah, so there are opportunities, the jobs are there, but we also have to be very strategic. There are different jobs and different positions at all these different anchor institutions. So Rutgers jobs are different than Prudential jobs.
By the way, an anchor institution is?
Anchor institution is a legacy institute. It used to be eds and meds, or educational institutions and medical facilities that made up the anchor, in a sense, of the economy. But now we've expanded that to include corporations and government entities as well. So these are the traditional big hiring entities within in a city. But we can prepare them. We can make sure that they have all the opportunities that are necessary. But this is a slow process. It's something that will take some time, but the investment is ultimately going to be worth it.
Kevin Lyons is Associate Professor for the Department of Supply Chain Management at my alma mater, Rutgers Business School, more specifically. And thank you so much for joining us.
Thank you.
All the best to the folks at Rutgers.
Thank you very much.
Okay. We'll be back right after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We're pleased to be joined by Tony Russo, President of the Commerce and Industry Association of New Jersey. Good to see you, my friend.
Happy to be here, Steve. Thank you.
The state of commerce, by the way, your website will be up throughout this entire segment. The state of commerce in the state of New Jersey, how would you describe it?
At this point, tentative. I think a lot of our businesses are worried, concerned about what's going to happen in Trenton with the budget and the taxes, and whether or not we're going to have taxes or not have taxes. So I would say tentative but cautiously optimistic. So business is good, but I'm waiting to see what happens.
By the way, when Tony says that we're doing this right before the budget is supposed to be struck in the state of New Jersey toward the end of June 2018, and it will air after that. But let's talk big picture. You talk to business leaders all the time. If, in fact, there is a quote-unquote millionaire's tax, an increase taxes on millionaires, I believe, help me on the, I think it's right now it's 8.9%. It could go up to
10.25, I think.
10.25. Someone says, well, it's only a good percentage or so. What's the big deal? What impact, if that were to happen, do you think it would have?
Yeah, because I think it's a cumulative effect. So when you think about that one tax combined with all the other taxes that our businesses pay, I think there needs to be an appreciation that a millionaire's tax, a lot of the millionaires, and I think there are about 18,000 in New Jersey, also employ a lot of our residents. They own the small businesses. And so they're going to take that all into account, and I think the impact will be that those millionaires will decide whether or not the view is worth the climb and whether or not they should leave the state.
What happens when a business leaves the state? And by the way, where do they go, Tom?
A lot of them relocate to Pennsylvania, right next door.
Lower tax rate?
Yeah, Delaware, New York.
Lower tax rate?
Lower tax rate.
Florida, no taxes?
Florida, no
income
taxes,
tax.
no income tax in Florida. So it's a cumulative effect. It's a pancake effect. I mean, so you put one pancake on another. Each one is a tax, a fee. And then when they take it big picture, they'll say, you know what, it's time maybe to move elsewhere.
Okay, by the way, we're talking to Tony Russo from the Commerce and Industry Association of New Jersey. By the way, we happen to be promotional colleagues. We cross-promote each other's work. But I'm curious about something. What about those who say, you know what, people who have the most should pay their fair share, so what are they complaining about, you say?
Yeah, and they do. I mean, a lot of our companies give back to the local community, charitable good works. Again, it's not a question of whether or not they should are paying those taxes. What our companies want to see that the Trenton, the lawmakers also take a look at cutting spending. And that's something that's not happening right now. There's all the talk about raising the corporate business tax, the millionaire's tax.
Yes, by the way, Senate, sorry for interrupting. The Senate President, Steve Sweeney, was right here on this set on NJTV talking about a corporate tax. Governor Murphy is proposing a millionaire's tax, an increase in the sales tax. We don't know what's going to happen. We'll see. Cumulative effect.
But the cumulative effect in that, and really what I wanted to say, what's absent in the discussions, right, in Trenton right now between the governor and the state legislature is any talk of really spending cuts. And I think that has to be put on the table.
The proposed budget, again, we don't know what's going to happen, is an increase, is it 1 point, help me on the number, Michael Aaron, who's in the newsroom, he'd have this number. I think it's $1.5 billion. That's not a cut.
Well, but I guess the point I'm trying to make is that, to your question, do our businesses want to pay those taxes? They would pay those fair taxes if there's also discussion on trying to cut spending in Trenton. So if you're short $1 billion, I think you're obligated to also look at the programs to see where you can save some money and make some cuts before you go to raising the taxes. But also the other thing I want to mention too is the fact that the third item here, and we say it all the time when we testify, is they should look at
testify before the legislature.
I'm sorry, before the legislature, is increasing the tax base. So the number of entities that actually pay the taxes.
More people paying.
So bring that investment into New Jersey.
Okay, how about this? State and local deductions, SALT. Right?
SALT, right.
The Trump administration argues biggest tax cut years stimulating the economy, but in states like New Jersey, Tony, speaking to Tony Russo from Commerce and Industry Association, it's a $10,000 cap on which you can write off on your taxes for your state taxes and your property taxes. And I live in Montclair. Let's just say we pay our fair share and then some. But then you got the state income tax. You can only write off 10 grand. That's it. Most folks in New Jersey, they pay a lot more than that in state and local property taxes, right?
Yep.
What? That's killing people. How is that making sense for a state like New Jersey?
It doesn't, and that's one part of the governor's proposed budget that we actually support, is he wants to raise that cap for that SALT or state and local taxes up to $15,000. So that's one thing that he proposed back in March that we actually, as a business community, support.
Hold on, I want to be clear.
That cap.
The state is saying, let's raise the cap
from $10,000 to $15,000.
And the Internal Revenue Service in Washington is saying, hold on one second. We have a new federal tax law. You can't mess around in a state and change that. That's a federal issue, not a state issue.
Well, it's not. It's the deduction that I'm allowed to take at the state level. So this is on your state income taxes.
Oh, on your state income taxes. I'm sorry.
So your cap will go up to $15,000. I don't know if that makes sense. I mean, I'm not an accountant.
No, but I will say this. It's hurting a lot of people.
Yeah, it is.
That deduction.
And it's a mixed bag. It's a mixed bag.
By the way, what do you think most, let me switch gears on this. Gateway Tunnel, I've been asking everybody this issue. It sounds like an infrastructure issue. Got a minute left. Gateway Tunnel, New York, New Jersey, going through Lincoln. How important is it to our state?
It's so important to our state that at the Commerce and Industry Association, we launched a transportation forum dedicated just to focus on transportation issues. Not only in our roads, bridges, and tunnels, but also ports, seaport, airport. We want to try to bring it all together and try to improve how our products and services are delivered.
Is that a commerce issue?
It's absolutely a commerce issue, absolutely. And we support the funding of it. We hope it's funded totally. We
The Gateway Tunnel.
The Gateway Tunnel. But I think we need a state transportation plan on trying to move traffic around the state. I think it all needs to be tied together.
It's interesting. People say it's a transportation issue, but in fact, it's an issue that involves commerce, economic development, quality of life, traffic.
It's all tied in.
Anthony Russo is the president of the Commerce and Industry Association of New Jersey. Also, by the way, check out their magazine. It is, in fact, called
Commerce Magazine.
It's amazing how that happened. This is Steve Adubato. This is State of Affairs. Catch you next time. Thanks.
Thank
Tom.
you, Steve. Thank you.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Varus NJTV studio at 2 Gateway. Funding has been provided by RWJ Barnabas Health, Delta Dental of New Jersey, the Turl Fund, supporting Right from the Start NJ, the Nicholson Foundation, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, NJ Best, and by New Jersey Sharing Network. Promotional support provided by Jaffe Communications, where business, media, and government converge in New Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.
What is your child's dream for the future? Doctor? Teacher? Architect? Whatever they aspire to be, a college education may realize those dreams. And NJ Best can help. It's the college savings plan specifically designed for New Jersey families. Start saving today with as little as $25, because now is the time to invest in their future. To learn about NJ Best 529 College Savings Plan, its investment objectives, risks, and costs, read the Investor Handbook available at njbest.com.